Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to The Consult Before the Cut. As you can tell, all of the ladies here around the table are wearing our Do Not Care Club. This is our official submission
Welcome
into the Do Not Care Club, the Baton Rouge chapter, because we don't care. We don't care about anything anymore. God bless this person on social media. Her name is Just Being Melanie. That is started this wave of movement of every woman.
Thank you, Melanie. We are a proud part of the Do Not Care Club.
Don't care.
Louisiana, proud.
I don't care. Don't care. I don't care about anything. I just don't care.
Encouraging girl talk and realness throughout
Yes.
the United States. We are here for it, girl, and we are supporting you. We are part of your movement.
This is what happened when this is what happens when Doc's not here. We're like, great. Now that he's not here, check it out.
Girl time.
It is absolutely girl time. The only thing we're missing is margaritas to make this real
Amen.
interesting.
Yes.
So yes, we this is going to be another girl talk episode. So y'all, I think we should probably start doing like the girl talk episodes more frequently.
Yes.
So we can, get in here, talk about it, do all the things, bring all the texts that I could probably pull up an entire text thread about like
Girl talk,
vaginas, all the things.
Lady things.
I'm pretty sure I text Bree. I was at a friend's house and somebody had asked, Rejuvime, hey, do y'all have, it was oxytocin that we were talking about.
Yes.
I hear you can take it before sex and it, like increases sensation and all this kind of stuff. I was like, oh, we absolutely have that. Give me a minute. And I was like, hey, Bree, I'm like, can you send me in a prescription for oxytocin so I can take it so I can be able to tell people what it does? She's like, yeah, sure. On the way.
Here for it.
I'm like,
Yes.
okay. I'm like, I love that. That's
Confirmed
great.
address.
Confirmed address.
So let's formally introduce
All
this
right.
girl.
Bree Berard,
Hello, hello.
third-time visitor to the Consult Before the Cut podcast. Telling you we're going to have to get like the SNL 5-timer jackets at some
Ooh,
point and
that'd be
give them
nice.
to Bree.
She has earned it. So nurse practitioner at Rejuvime.
Yes, so we do all things hormones, female, male, some weight loss stuff at our clinic, and then a little bit of cosmetics as well. But love to help out these females with their issues, especially in the sexual sensation department, just not feeling how they used to, which comes with age, comes with time, and we can help you.
Amen.
Everyone needs help.
We all need help.
Everyone needs help. We Taylor and I did an episode on Thermiva, and we were
Yes.
talking about how it's just a body part. The vagina is just another body part that's aging with us, but like nobody's allowed to talk about the vagina.
Yeah, and just normalizing it and that these symptoms and effects are real, and just modern medicine is changing things, and this movement is changing things. So we are all
Yes.
communicating about a real problem that's part of, a female's life.
Totally. So yeah, as we age, and even sometimes I like to equate it. I haven't personally gone through menopause yet, but I did go through childbirth twice, and after you have a baby, these symptoms can occur. You get that huge drop of hormones, and it kind of mimics menopause. You have the hot flashes, you have the night sweats. Your body's like, what is happening to me? You have the dryness, the loss of sensation, loss of libido.
I just want to let you know you're not far from this menopause movement.
No,
Very
I am
menopausal.
so young. I'm so young. I'm so
actually
vibrant.
24. Thank you
I'm
for
12.
having me.
But yes, so very similar. So even though I haven't gone through menopause, I've gone through that, and seeing the things that we can offer these women and trying those treatments really was helpful.
Well, that's why, because, we talk about, women have been so quiet. We take everything in stride. It's
It's just part of life.
It's just part of life. This is what it is. And it's like, wait 1 second, and like, I always go back to Halle Berry. Like, she was the one, I feel like, that really kind of punch this into high gear, but like, good for her. I feel like so many women have been helped. There's all these, I get like the Instagrams like, ooh, masterclass on menopause, you don't have, all these doctors are talking about it. Everybody's talking about it. And it's just like,
it is definitely on the forefront. Now,
because
thankfully.
Everybody's been talking about guys and sex, and if they, can't get an erection, here's 14 things that can help you, and all
it's
of
like,
these
where's
things.
that for me?
Hey,
actually, it's here.
It's
what?
It's here. All you gotta do is say something.
I gotcha.
All you have to do is say something.
Asking you shall receive.
Why does you tell me the reasons why the vagina ages? What happens? Give me like a little bit of medical, a little bit of life.
Yeah. So as your estrogen and progesterone decrease, the vaginal tissue actually depletes of that as well, which loses moisture, and it can actually shrink up or atrophy. And it's a medical thing. I mean, it's a whole diagnosis, vaginal atrophy due to loss of estrogen or menopause.
This is if you don't use it, you lose it.
If you don't use it, you lose it. So huge things, and it can cause irritation, painful sex. It can also cause frequent UTIs, and just being uncomfortable. It also can look different because it is shrinking that tissue, and we can fix that too.
Well, having like that, like we had talked about before, that skin laxity and everything. It's just not. I know we always talk about when you're young, you're plump. When you're young, you're plump. You have this extra, fat that makes our cheeks, our lips,
the hydration,
everything. It's there. It's the same thing for the vagina. As you age, you're losing that plumpness, and it's like, don't worry, we can do that. We can, we can help there, because appearance, I think, is very important as well to a lot of ladies and everything. Once again, just referencing back to that Thermiva episode that we did, it's just like, you can help the inside, but you can also help the outside as well.
Yes.
You don't have to.
I mean, hormones, like you said.
Yes.
Weight fluctuation.
Yep.
Gravity, just natural gravity. Childbirth.
Yeah, all the trauma.
I mean, all of those things can affect a body part easily.
Yes.
I mean,
easily.
It's very, very common in females. So
it's common and it's normal.
Yeah. It's normal.
Normalizing the conversation is why we're here right now.
It's normal. You don't have to just accept it, though. I mean, once you accept it, you can say, okay, this is normal. This is what happened. But what am I going to do about it? And I think that's the important step is, what am I going to do about it? Are you going to do not care and live with it? Or are you going to do not care and do something about it? You know?
Yo, no, I don't care. I'm going to come talk to you about my vagina.
Come on.
I'm going to talk to you
Come on,
about
and
it.
I'm
Like,
gonna
when
fix
we
it
get
right
to
up.
that, I'm going to be like, hey, girl, help my vagina. It's just, it's absolutely, let's, bring it up. Let's talk about it. And I think people don't know. I don't think people do know that there are treatments that you can do that help in this realm of things. That aren't, having to take hormones again. Like, there's stuff because I know, like, a lot of people, sometimes the hormone, is scary to them, even though, it doesn't have to be. And there's other things that you can do that are not hormone related that can help in that area as well.
What do you do? So we're going to get to our topic today, but what are things under the umbrella of vaginal rejuvenation?
So many things. So you can do creams. There are creams with hormones in them, like estrogen creams, and those are just absorbed in that area. They're not a systemic thing, so it's not a scary thing, but those are really helpful, especially if you have UTIs. There's hyaluronic acid suppositories that you can insert vaginally, which are really great too, and those are a non-medicated thing, just like on your face. You use those creams and lotions and potions, right?
I did not know that.
Yes, amazing. And they're over the counter. So you can do that.
We have, so I have heard, we have a CO2 mask.
Yes.
That you can obviously place on the face. but they have
You
the
can
CO2
place-
V. What is
Correct.
it? The CO2 lift V that is a
carbon,
gel that is a suppository of, and
Yes.
it's
And
helping
it
with
helps too.
lubrication so much.
Yes.
So you
Oh my
can
gosh.
CO2 your vagina and your face.
Okay, so this is not CO2.
Not the laser.
There is a CO2 laser for the vagina comparable to Thermiva, but it's the CO2 mask for the face is actually now compounded for the vagina, and it's
Yes.
bringing lots of hydration to that.
Lots of
area.
hydration. And then you can also do injectables in the vagina. You can use PRP. You can use filler. Some people even use like biostimulators there to help revive, replenish.
Yeah.
Super helpful.
I love it. So we have all the things.
I would
All the
say
things.
the trending or the most popular, in my opinion, in addition to what you said, are the lasers.
Yes.
And so radio frequency is something that we have here, Thermiva. There are at-home therapies that, red light is now trending. So there's red light
Everybody's got a red light.
pins basically that you can place into the vagina to stimulate. And at the end of the day, all of these things are stimulating blood flow and collagen production, which is increasing all of the secretory glands, the tightness of the area, and helping with the overall wellness.
Yes.
FemLift is the CO2 resurfacing that I think would be a little bit more uncomfortable. I'm not honestly completely familiar with that device, but there's tons of things that are available to us. But I definitely am excited today because we're going to focus on the PRP and the
Yes.
filler of this area, right?
Correct.
Okay.
But it's almost it's like as you sit here and we sit here and talk about like, oh, they have like lasers, they've got creams, you have HA that you can put, all this kind of stuff. It's basic. It's just kind of like we talk about our face routine.
Yeah, truly.
It's our face routine
yeah.
for our vagina. Like that's what that is.
Yeah, we
Correct.
used to do filler and PRP in the face. We're now doing it in the vagina.
Yep.
We are.
Our bodies love it, obviously. So it's like,
We have plenty of it in our faces.
we have so much of it here. Why
Yes.
not start spreading the wealth? So yes, with that being said, we are going to have Bree talk to us about PRP injections, which means platelet-rich plasma injections inside the vaginal canal, outside as well, and then also filler being used for an appearance, an aesthetic on the outside, but also you can put filler inside of the vaginal canal as well. So
Yes.
we are going to dive into all of these today, and it is going to be super exciting because it is super exciting. We have a patient that absolutely loves it.
Nice.
All right, Breezy. Let's go through, first of all, we kind of touched on a lot of things of why these women are coming to us, like we said, these hormonal changes and stuff like this. But so with even with hormone supplementation and, if you're doing all the jazz and whatever, you can still have
these
sensitivity issues.
Yes.
You can still have
Or discomfort,
discomfort because of dryness, anything like that. So even though, or you don't have to be. I remember we did one of our staff members who was young.
She was young and vibrant. She was like, decreased sensation, decrease in orgasm. She's like, I want to try it. I'm like, okay,
let's
get
do
on
it.
the table, sister.
Yes. And okay, so let's talk about like what it is. The PRP injections, what we do. So patient comes in,
we draw their blood, we spin it down and get that nice gold plasma at the top. Draw it up in a syringe, and then you are ready.
So it's wild
that's it.
because
It's
like
wild.
that's your prep.
Yes.
But where are you injecting the PRP? Is it specifically for the clitoral hood area or primarily?
You can put it in the clitoral hood. You can put it in the G spot to kind of expand that area a little bit and bring back some of those.
Wake
Little
everything
sense.
up.
I'm
Hey,
like,
girl.
do like a little this. Wake up all of those like little sensor areas. And then you can also just put it in the canal itself to help with the dryness in the area.
That's
too.
injection.
They
as
are
well.
all injection. And it sounds like it would be really painful. Like, I know the first time I heard of it, I was like, oh my gosh, like I am Kegeling right now thinking about that. But as we were like training on it and doing it, the girls were very comfortable. They don't feel it. I mean, if you think about it, there's a lot of trauma I mean, that goes in that area. I mean, we're using tampons, we're having intercourse, we're,
all the stuff,
all of the things, childbirth. You really don't feel it. I mean, you can feel the pressure that something is there, but it's not like the needle pain.
Well, like the first time that we started looking into this and we sent one of our nurse practitioners to a training and they came back with it and they were like, this is what it is or whatever. My mind immediately went to a biopsy. Yes. And I was like, oh my God, absolutely not. Nope, not doing it.
But like the biopsies are so barbaric.
But with that,
this isn't.
I was like, oh, that's not what this is. I was like, oh, and everyone, because I will say, like, for us to train on it, we did the staff.
Yeah.
Anybody on the staff that wanted to do it, we did it. And like she said, every single one that we did, they were just like, no, it's a little pressure.
A little pressure, maybe a little spotting after just because you did get punctured, but nothing you need to wear a pad for.
Nope.
I mean, nothing long term.
Are you numbing with topical?
On the outer area, you can. Like on the labia, if we're doing filler in that area just for appearance, yes.
But I think we also numb the clitoral hood as well when we do the PRP injections there. Yeah.
Be mindful. Yeah. But everybody was very comfortable.
And it's just it's a T90
needle,
90 little needle that goes in there with the injections.
Yes.
But like she said, go ahead.
And then the PRP is one treatment.
It can be one treatment. A lot of women do need more than one treatment to get full effect. Some women had 2 or 3 treatments. Some had up to 4. But it really just kind of depends on your degree and how much more sensation you want. For some women, they're like, oh, okay, I feel something when we have intercourse, or I'm having a little bit less pain, and that's enough for them. And some women are like, this isn't the climax that I want. Let's try it again.
Yeah.
And that's okay too. It really is kind of patient dependent and specific to your needs, because some people don't care.
Yeah. Well, and and the good thing about it is because you're using your own PRP and putting it back in your body, it's not like you're like,
you can't reject it.
Like you're going to have to wait for a while to do this again. No, like you can continue to do it.
Correct.
I know you can do it like every 10 to 12 weeks.
Yeah.
You can do that. But even if like somebody who's been doing it, I know we had a patient that would do it every 8. And it's okay because we're not.
It's totally fine.
We're not.
Yeah, it's you.
It's
I mean,
you.
It's your own.
It's you helping you.
Yeah.
At this time.
Yeah.
So, but it is a very it's so interesting. We use PRP for all kinds of stuff: hair growth, face, all kinds of stuff.
And if you think about it, like how it helps your hair and it helps your skin, it's going to help the same thing down there. It's going to help the skin kind of rejuvenate. It's going to help that G-spot get some sensation back. It's going to help with the size of everything too, so it gets a little bit more plump. Which is helpful as well.
Yeah.
Well, and that's another thing. So switching from PRP to the filler, like when we're doing filler in the outer labia, like we said, like that fat loss and stuff like that, it can become painful because underneath that it's just bone.
Yeah.
And so it's like you don't have any cushion.
Talk about the anatomy. So that outer layer. Talk about the different labia majora, minora, where that goes, all that.
Yeah. So it's there.
What is the outer lip?
Outer lip is that labia majora, and then it's plump. It's skin.
Thicker.
We're like doing our little hands.
I know.
Like it's gonna be this big. It's not.
Do not care.
I don't care.
And then inner, you have the labia minora, and then you have that clitoral hood right at the top, and then of course like the vaginal opening.
So yeah, like that's what I kind of like. So I know this is terrible, but
it's like a little oyster.
For all of it's an oyster. So for all of our people that are watching, so it's kind of like this, and like here, the clitoral hood is at the top. And then you have your vagina here. And then I know we did like the labia minora is that thin
tiny baby layer.
Yes. And so, that's a whole comfort thing. I know we did a whole thing on labiaplasties and whatnot. But being able to get some
normalcy
back
fullness,
into that after, like you said, weight loss. GLP-1s are all over
the rage.
It's all
everybody's
over.
on one.
And these girls that are losing weight, you're not just going to lose weight around your abdomen, all that kind of stuff. You're going to lose that in that skin in your vagina as well, which makes it could be painful because there is nothing there to kind of help cushion while
I've had
having
patients
sex.
when they're walking it rubs.
Yeah.
Yeah.
Whenever they're like in intercourse, it's in the way.
They'll tell me they don't want to wear jeans because
they
it's
don't
like
want to wear
rough.
jeans.
Yeah.
Yeah. And going back to a labiaplasty, obviously there is a lane for these lasers, radio frequency, injectables, creams. Obviously, labiaplasty is an amazing option as well.
Correct.
To actually surgically remove, it's very easy, remove that excess skin.
Yeah.
So tons.
There's a lot of options out there. But I think this specific option can really be used in any female, young, old, whatever. And there's not a lot of risk.
Yeah.
Really no risk.
Yeah,
because
so
it's your own.
It's you.
It's your own body.
With
It's your
the
own
filler,
cells.
it's hyaluronic acid filler.
Yes.
Okay. What products do you usually use?
Gosh, I feel like we used
Ultra
Plus.
We used Ultra. We used Ultra
Yeah.
Plus. We didn't use which Ultra and Ultra Plus are kind of like mid-range.
Pretty comparable to each other too, you know.
Yeah, and I'm trying to think because it wasn't like obviously we weren't doing any Voluma or anything that.
No. But Ultra and Ultra Plus, they're nice and soft. But then they, of course, add a little bit of volume and hydration back. So those are really good to use there.
And it's usually 2 syringes per treatment, right? That's what we do. Okay.
So not only with plumping that outer labia right there, using the filler inside of the vagina to behind the G spot to kind of
lump that area too.
Yeah.
So it's a little bit easier to hit.
We're making the bullseye
Making the bullseye
Easier.
bigger.
a little
Got it.
bigger.
Got it.
And so increasing that sensation and everything like that can help with sensation, orgasm,
Sensations,
all of
orgasm,
that.
and
So-
comfort for your partner too.
Yeah.
So
There's a lot of benefits that you can get
So
from
many.
these procedures.
it just brings back that confidence, you know?
Sexual sensation improves. Not with filler, but with PRP, you can see better lubrication.
Oh, absolutely.
Lubrication, the appearance, obviously. Is there any improvement with incontinence, or is that more of the...
It can definitely improve some incontinence there, just because you're giving it that support that it needs.
Okay.
And not just that, like we were saying, with that increased blood flow. The increased blood flow and everything.
It's helping all of those little muscles too.
All of it. It's just kind of making your vagina vibrant again. And I mean, that's life-changing for somebody who, wants to be able to have sex and enjoy it. Because I think that is also like a thing.
That's the part. We'll just do what we're
You're
supposed
just
to do.
doing it.
And it's like, what? Like, I'll have patients that are like, I feel really good, but like, it's still not enjoyable. Like, my hormones are better. I'm not having hot flashes. I'm feeling more like myself, but I'm numb. Waist down, I'm numb.
Yeah.
And she's like, I'll do everything it takes. And I'm like, oh my goodness. Like, you don't have to feel that
You
way.
don't know.
Let me help you.
You too can enjoy sex. It's not just for your husband.
Not just for your
it's
husband.
like-
I'm always like, saving lives and marriages.
We got carried away with girl talk. We did not break. Should we
we would like to thank our sponsors. We're going to take a break and we're going to come back and finish this up. Before we do that, we want to thank our sponsors, Weiler Plastic Surgery Group, the largest aesthetic and plastic surgery group in the state of Louisiana with 1 million injectors. Taylor.
All the surgeons.
5
So fun.
surgeons. You have like 10 locations now. And then Rejuvime Medical, your HRT GLP-1 go-to establishment here across the Gulf Coast. We're in Louisiana, Mississippi now. And so we are going to pause this girl talk for just a quick second and we'll be right back.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. The college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
Hey everyone, welcome back. All right, so we have kind of covered kind of the ins and outs, if you will. Of,
all things vaginas,
all
PRP, and filler.
all things vagina. But now we do have some questions. Since we've kind of talked about PRP and filler together,
Sure.
Is this something that do you do it together? Do you get the PRP and filler, or could you just do one or the other?
Yeah, is it
or?
one? Is it together? Is it separate? Do you need both? Do you not need both?
It really depends. So, for example, if you were doing someone on the younger spectrum, just to kind of help with that sensation,
Like her, she's trying to Taylor. This is a dig. This is a dig.
It's not.
I'm
It's not a
in
dig. It's
perimenopause.
not a dig. It's for those women who are satisfied with the aesthetic look of their vagina. They probably only need the PRP. So for them, they can do that by itself. For women who want a little bit more fullness and plumpness on the exterior as well, or just like that look, they'll need to do the filler with the PRP injections, and we can do that together. It doesn't have to be done separately. I would recommend doing it together. That way it's just one and done.
So the PRP is repetitive treatments, but the
Yes.
filler could be one and done and would
Correct.
last about
Yeah.
a year to 18 months.
Yes,
right?
same as
Yeah.
it does in your face.
Same as your cheekies.
It may last a little bit less, just depending on how much activity and, that kind of thing.
Okay.
Same with your face.
Yeah. Same with your face.
Exactly.
Yeah.
What about downtime?
No downtime. So come into the office, get this taken care of, and then you're back to resume normal activity immediately after. I usually give them a little panty liner just to make sure if there is any spotting, but you're good to go.
And the procedure doesn't take very long either.
Okay.
It's not.
No, it's not long.
No, it could 1,000% be a lunchtime procedure.
A little
Okay.
lunchtime. A little quick.
Draw the blood, spin
Draw
it down.
the blood.
Yep.
And that's what takes the longest
Is
time.
the spin.
It's the spin, and then it's the provider making sure they're in the right spot for that sensations, because everybody is a little bit different anatomically. So they're, feeling around, making sure we're getting it where it needs to go.
But still not as
Not
uncomfortable
long, yeah.
as a PAP.
Oh my gosh,
yeah,
way less
which is
uncomfortable.
wild.
Right.
Which is absolutely wild. But okay.
And then creams and all that can be resumed same
Creams
day.
can be resumed, everything.
Okay.
Go
Yeah.
back to norm.
And this, this particular procedure is not taking the place of your hormone therapy and stuff like that.
No, absolutely not. I think best used in conjunction. I don't think it's a one or the other. It does not have to be both, but I do think it works best if you're already supplementing with those hormones to help restore everything from the inside out.
And this is Taylor's spiel about if you're going to do the injectables, make sure you're doing the face care, the skin care that goes along with it.
Yeah.
Same
thing.
concept.
Same
Yes,
concept.
same
If you're
concept.
going to do that, make sure you're taking the hormones to help,
Yes.
continually increase the lubrication, sensitivity, all that kind of stuff. The libido. You still
libido.
want
You
to have
still
sex.
need it.
Right.
Yeah. You still need
It
that.
needs to be there.
This is termed, or there's a patent, I guess, on the O shot. This is the same thing-ish.
Same concept.
Same concept?
Yes.
Okay. That's more the trending term. But
They use
Yes.
a little bit different specific devices and methods, but very, very
Same
similar.
goal.
Same goal.
Okay.
There was the O shot. Now this is, ADD right here. There was the O shot. What was the P shot?
The P shot is the same thing, but for the penis.
For the penis. That's what I thought.
Yeah.
So it's the
and we
O
just
for the
don't
gals.
do that just because, I don't know about you guys, but I just don't want to sit there in my office and hold a penis.
I went to a conference recently, and penile injections
I mean,
are where it's at, supposedly. Yeah, I know.
Dr. Weiler said
I've
that
never-
a couple weeks ago. He
yeah,
was
and I'm
"It's a thing."
can you just
It is a
imagine me
thing.
holding a penis in office?
Okay, Bree, I will talk to Dr. Weiler. You will be injecting penises within 2 months.
Stop it.
Bet.
I love this. I love this.
I'm telling
done.
you, it's
I
very
would-
straightforward and easy, and patients love
I'm
it.
sure it's
See,
literally
I
an
have
in and out zone.
I have so many questions about that. How much filler? When it's erect versus not? What's the filler look like? It's just.
I don't know.
We're gonna have to do it. That's gonna be another.
That'll
that's gonna
be another
completely
day. That's
other-
boy talk.
That's boy talk. And
This
we
is
ain't
girl
here for
talk.
that. We're here for the girl talk today. So okay, with the the PRP injections
Yeah.
and everything like that. Where is that landing me in cost range?
Okay, so cost-wise for the PRP injection, that's going to be $1,250, and then if we do filler with that, you'll just pay per syringe for that.
Okay. Because some people may need more or less of the
Absolutely.
syringe.
Volume.
Yeah, more
Actual
or less
volume.
volume and stuff like
Yep.
that. Okay.
Same as the face.
All right. I'm trying to think of
Anything else? What would you tell patients that are interested? They have maybe a dry, saggy vagina and they're sad about it but don't know where to go.
Tell them to come talk to me because open conversation. I always say my door is open, but like there's walls in here. So no one else is going to know what we talk about. So if you're nervous to talk to me about it, it's okay. It's okay to be nervous. Just open that conversation and I'll help you through it.
Because we don't care. We'll
'Cause
talk
we don't
about
care.
anything. We'll
Not
talk
here
about
to
anything.
judge, just here to help you. And it's okay to talk about it.
Yeah.
Yeah. Open that conversation.
Open it
Once again,
up.
we all have vaginas.
We all
Right.
have one.
Right.
All.
Make it comfortable.
They're
Yeah.
all the same.
Yeah.
I'm like,
Here to tell you.
Yep.
I feel like
Yep,
the
yep.
little kid for, was it kindergarten cop? Like, vagina, vagina, vagina. It's like, say it loud and proud. Start talking about it. This is great. And
Yeah.
like
it
Bree
truly
said,
is a great treatment. Really easy to do, really uncomfortable for the patient, and you get a lot out of it. So I do highly recommend it for those who are interested in something extra.
Love it.
I love that. So, ladies,
Cheers to the Do Not Care Club.
Justine and Melanie, you are a queen. Thank you for this. I love this. I always talk about how I love that everybody's talking about this now.
Me
because
too.
I'm going to be going through this here
Truly.
very
Truly.
soon. So I'm like, I really like that.
We're here for it.
Lay the groundwork, and we're just going to come.
Yes.
Yeah, we're gonna bring it up. Well, Bree, thank you so much for joining us on the Baton Rouge
Thank y'all for
chapters of the
having
Do Not
me.
Care Club. Also, the consult. The consult before the cut. Thank you. Everybody remember to like and subscribe. Listen to us. We're on all the platforms, Spotify, Apple, all that. Thank you again for joining us. Keep the conversation going. Always stay curious. And always remember to consult before you cut. We'll see you next week.